This issue of first impressions of any, whether it's people or devices or technologies, is important, and my own personal story kind of reflects that. In my training, I was very involved in some of the early studies involving radiofrequency energy delivery to the GE junction as a form of treatment for reflux, and some other technologies. And so in the early 2000s, we saw a variety of things. Some were almost injectables to kind of plump up the GE junction, almost like something you would do to cosmetically for your lips or something like that. People tried burning kind of that muscle to sort of tighten it or thicken it, or perhaps reduce the number of relaxations. So I think that, unfortunately, a lot of these techniques didn't respect the anatomy, which we discussed earlier, and I think that some of them were associated with some adverse events, with some of the injectables being injected into blood vessels and leading to embolization issues. So I think that perhaps primary care physicians saw some of this and said, well, the endoscopic options are maybe not effective or not ready for prime time, or in some ways risky. And certainly the insurers also have been reticent to cover some of these things, so that's created a financial barrier for patients as well. So I think that, and me personally, I was interested in all of this from about 2005, and then I took a more than decade hiatus, in part because of some of these experiences. So I can't say that I don't understand it, because I sort of was in that category myself. And then I think that as time went on, people learn, and I think we've sort of learned to respect the anatomy, and I think we've learned from our surgical colleagues, and I think we've realized the importance of the hiatal hernia, and I think we've realized how important it is to correct that in cases where it's more than 2 centimeters. In combination with all those sorts of things now, I think we have really much improved results. I think we've worked out some of the issues with regards to making a very safe procedure. And we now are starting to see not only symptomatic improvement, but improvement in objective parameters, which has always been the criticism, is that these technologies make people feel better, but they don't actually normalize the underlying condition. And I think now we're starting to see evidence that these technologies do that, and that they also have some durability as well.